Yeah, and the interesting part is like the A part of it, adjust. In the
Yeah,
CBT technique, the adjust stands for like that's what chiropractors do, right? Is like the hands-on adjustment, which again I do a
right.
couple days a week in a brick and mortar office, but I also adapted that to so I can work with people more virtually if I can't direct them to a chiropractor that I would recommend. Okay,
Right.
where and even if you are seeing a chiropractor, this adjusting your lifestyle still applies because the adjustment lasts like 2 seconds, like boom, you get adjusted. The effects of it last longer, but it's not a permanent fix for the spinal distortion. And that's where the adjusting your lifestyle comes into play, and also the T part of it, of the Eaton method, which is the traction. And this is, supportive or corrective spinal traction. And how I'll describe this is like how orthodontists put braces on teeth to correct the spinal structure. So